Assalamu alaikum, the communication day. First scenario, Mr. Sami, 55 years old, admitted due to tiredness and jaundice. The CT with contrast and tumor markers then revealed that he has pancreatic cancer and mets to lymph nodes. Please discuss with him the palliative treatment and for possible option of ERCP. Ready? Dr. Sarah?
Yes, doctor. Yes.
Okay, here you go.
Hello.
Hello. Yes, doctor.
I'm Dr. Abdul Karim. I'm one of the doctor covering the service today. May I confirm that you are Mr. Sami, 55 years old?
Yes, doctor. I'm Sam, 55 years old.
Mr. Sami, we are here to talk regarding your health condition. Is that okay with you?
Sure, doctor.
Okay, so before I proceed further in our discussion today, do you want anyone else to attend this meeting for supporting you?
No, doctor. Thank you very much.
Okay, could you please tell me how much you know regarding your health condition?
Yes, doctor. I have been complaining from tummy pain and some tiredness and also lose motion and some itching. And my color turned into yellow. So I came to the hospital since 2 days. They did for me some investigation and some scanning. So I am here to know the result of scan.
I'm sorry for suffering, Mr. Sami. Thank you for sharing this information with me. Mr. Sami, the result of the workup and scanning that was done for you now with me. And I'm sorry to tell you that I didn't have any good news for you today.
Oh, doctor, why? Why not good news? I think I expect that it's some bug infection in my tummy. So why not good news?
I'm sorry for that, Mr. Sami. Actually, you didn't have infections in your tummy. But the scanning, it reveals that you have cancer, which affects the gland located in your tummy, which you call pancreas.
Oh, doctor,
Have you ever heard about?
Are you sure, doctor?
I'm sorry for that. Yes.
I think someone else, someone else other than me. I think that doctor. Are you sure?
Mr. Sam, I'm quite sure. I'm telling you now regarding your result of scanning after I'm double check the result for you. I'm sorry.
Oh, doctor, it is really very bad news.
I understand your feeling and your reaction, Mr. Sam.
So
I know this is hard news for you today.
Thanks, doctor, for your feeling. Okay, doctor, the cancer is cause of me this yellowish discoloration and this tiredness?
Yes, so if you give me a chance, we will explain to you regarding this cancer and your condition now.
Yes.
So try to draw for you to make it simple to understand it, Mr. Simon. This is your tummy, imagine with me, and this is the gland located in your tummy, which you call pancreas. And the cancer affects these glands. And I'm sorry to tell you that now in your conditions, this cancer is spread to the surrounding area, and also it affects the gland, which you call the lymph gland.
Okay.
And also it obstructs this canal. Yeah. Okay.
Okay.
Yeah, so obstruct the canal which connect between the liver and the bowel. So that result from similar manifestations that you are having, like this yellow discoloration of your eyes and tiredness and itchiness. So yeah, regarding this, are you understand me?
Yes, doctor, I understand you, but why is this obstruction cause yellowish discoloration?
Yes, because it obstructs this canal which connect the bowel and the liver. This canal normally transmit or produce some salt from the liver to the bowel. In your condition now, this it obstructed. So in such conditions, I'm sorry to tell you that because of your condition now it advanced, our team they decide that it is not curable. It is not even the surgery. It is not suitable for you now.
Why, doctor? I think I read from internet there is a treatment called chemotherapy. And why didn't you want to give me chemotherapy or surgery? Because
Appreciate your feeling.
I am still young, doctor. I am 55 years old.
Appreciate your feeling. I know how much this is hard for you. But be sure that we are here because of you, and we are here to do our best to help you as much as you can. So
Thank-
because of your condition now, it become like advanced. So our team they decide that to put you in the care which you call palliative treatment.
Mhm.
Have you ever heard about it before?
No, doctor.
Okay, so the palliative care or palliative treatment, it is like a special holistic care that the aim of this just to treat the symptom rather than treat the cancer itself in your condition. And this it will involve a group of specialists in which include the cancer doctor and the Macmillan nurse and also a psychologist and also other specialities and the nurse according to your needs. So just aim to keep you comfortable as much as we can and to help you and to improve your symptom and to reduce your suffering. Are you following me?
Yes, doctor, but you mean that your doctor decide for me, and I am the patient, and I am the one have cancer. So why doctor decide for about me? I am businessman. I can travel to anywhere. Why you not give me chemotherapy or surgery? Why
I
your doctor
understand.
decide that to let me die?
I understand your reaction, Mr. Sami. Not like that. Be sure that, Mr. Sami, your health is our priority, and also the our team. They, yeah, concerning regarding your health. But in such cases, the surgery and the chemotherapy, it is not help you, and it is no benefit in such situations. And just if you receive this, it can be suffered from a complications without no benefit. So that is why this decision was made in the best interest of your condition.
Mm, mm.
Is that okay with you?
Okay, doctor. Okay.
Okay, so now one of the parts of the palliative care, the decisions that to do for you some procedure, which you called endoscopic retrograde cholangiopancreatography. Let us call in the short term ERCP. Have you ever heard about it?
No, doctor.
Okay, so just I will explain to you
2
regarding
minutes
this.
left.
Okay, so before this, just we will review your medications and we will check your blood to make sure that you are fit for to doing this procedure. And this after that, we can give you some medications and to numb your throat. And there is the long, thin, flexible tube connected by the camera screen from outside should be introduced from your mouth, passing your throat, bathing your food pipe. So, please follow me. I'm going to
Yes.
draw for you.
Yes, better,
Okay,
doctor. Thank
until
you.
bathing your stomach until reaches the side of
Mm.
obstruction here. So just sometimes you can we can give you thumb dye to help us to show the side of narrowing exactly in this tube. And also sometimes it might give you or introduce some mesh plastic tube to keep this tube patent and to remove your symptom and to improve your symptom and your health now. This procedure, like any procedure, has the bad effects besides good effects. Sometimes it can cause soreness in this gland, which is called pancreas, and also it can cause infection and injury to adjacent area and bleeding. But be sure that this will be done by expertise hand who did such a procedure many times before. So what do you think, Mr. Sami, regarding to doing this procedure?
Is Dr. She will cure me?
Mr. Sami, your concern is valid, as I told you that this not as curable, but at the part of the palliative care, just to resolve and to remove and to improve your symptom now, and to improve your quality of days, your life.
Okay, doctor. So, doctor, you now will open the obstruction. So now I will get improved because the
Mr.
problem
Sam,
in the obstruction. Yes.
yes, I highly appreciate it. Yes, just to remove this narrowing or obstruction, just to improve your symptom rather than cure the cancer itself. So, are you willing to do this procedure for you?
Yes, doctor. If she any possibility to improve my condition, I am with you. No problem.
Okay, so there is the consent. There is consent, which is documented reporting. So involved with all information that we mentioned here, and the benefit and the bad effect of this procedure. And also, please read it carefully and sign it when you are ready. And be sure that if you change your mind at any time, you have a right to withdraw from this procedure.
Okay, doctor.
Is that okay?
Yes, doctor. Okay.
So, may I ask you some questions?
Yeah,
Yes,
actually,
doctor.
time is up, Dr. Sarah.
But you
Yes,
lose
perhaps.
you lose the concern, doctor. Sorry.
ده
Okay.
كله concern.
Concern.
السيناريو كله concern. Okay.
Okay,
I think.
let's read the comment, Dr. Mahmoud, then I will comment.
Yes. Okay,
Okay.
doctor.
So,
You
just
did.
I want to ask regarding the advance directive and loss of power of attorney.
Yes, I think it is a must.
Okay.
I think yes. And the most important is the concern. Okay. First, it is a real scenario. Came in exam. The same scenario. So you will start first. How do you feel now? What's your expectation? I will tell you. I expect infection, doctor. So I am sorry to you that it is not infection. It is a cancer in a gland in your tummy called the pancreas. Then you will discuss the cancer and the obstructive jaundice which the patient have. Okay, you have these symptoms: tiredness and weight loss and yellowish discoloration of the eye. I will tell you why, doctor, I have this yellowish discoloration. You will tell that you can draw. Yes, there is a small tubes in the liver. These tubes carry a kind of juice. This juice called the bile, because bile is jargon. So this tube carry a juice, help us in digestion of the food. When there is obstruction in these tubes, this juice can accumulate in the blood, cause the symptoms that you have: tiredness and yellowish discoloration. Okay, and then the explanation. Okay, I think the word of decided not good in palliative care like that. So the doctor assess you, and as soon as the cancer, you have cancer in this tummy, pancreas, and it is spread to the another gland called the lymph gland. That means that we deal with advanced cancer. What does that mean? He will tell you, doctor, yes, give me chemotherapy. I am sorry to you that there is no rule of chemotherapy. You will have all the bad effect of chemotherapy without any benefit. So it is not beneficial for you. And the cut يعني قطع الشك باليقين. No rule of chemotherapy and no rule of the surgery. You will have also all the bad effect of the surgery without any benefit. So you have now, so he will tell you, okay, doctor, what is your plan? Okay, you have cancer pancreas and advanced cancer. We have another module of treatment. It is called palliative treatment, and go on with the palliative treatment. Palliative treatment is a holistic approach aimed to improve your symptoms, and the main aim of this module of treatment is improve your quality of life and life as يعني life as يعني with good shape, يعني with good dignity, and this preserve your dignity. And okay, doctor, does this treatment will improve my because the problem in this patient has itching. I told you as the first, I have severe itching. I have discoloration. Okay, now it is in this module of treatment we have a procedure called endoscopic retrograde pancreatography. What is this, doctor? In brief, because the scenario is long. If you discuss all the procedure, it will be long. So in this just a brief, this procedure we can open up these obstructed tubules to be patent, to improve your itching and to improve your quality of life, like that. So doctor, she will improve me? No, I am sorry to do that. It's just to improve your symptoms, not aim to cure the cancer. And you can, if you don't have time, like this case, Dr. Bassem told you have 2 minutes, and you still discussing the procedure. No concern, no consent. So you will lose the station, Dr. Sarah. So you can just tell that we have to open and if 2 minutes, okay, I can give you some brochure and leaflet to read more about this procedure. Okay, and if you accept, you will give you consent. You have to read it carefully and sign it. Please, what's your concern? I will tell you concern when I will die, doctor. She will tell you, you will tell me, no one can predict this. Like cancer is decrease the shorten the life expectancy. But we are, and then if you tell me what is the another concern, I will tell you, please, doctor, tell me for how long I will live. We are talking in about weeks rather than months. That is the concern, because you will lose the concern. It is a big problem in the exam, Dr. Sar. So 2 minutes, okay, hurry and close anything concern. Because in the communication, because it is a palliative care and the new diagnosis cancer, you have any concern. The patient just knows that he have cancer, so he have many concerns. Okay, thank you, Dr. Sarah. Thank you, Dr. Bess.
Yeah, thank you, Dr. Mahmoud, for good
Thank
explanation.
you, Dr. Mahmoud, yeah.
Yeah, he explained really perfectly.
Yes.
And it's a complicated scenario because it contains 2 concerns or 2 tasks. The first task, the breaking bad news explanation of the cancer, and the second one, a procedure. As Dr. Mahmoud said, try to be concise in both. So in order to save your time, try to make it as together combined task. How? After breaking bad news, you have a cancer and it's obstructing or blocking the way of the bile, which is toxin. It make your skin yellow, and unfortunately it spread away from the liver. If he raised the concern of any chance, yes, use always the word of the best interest, the best of interest for your condition. Okay, because we are here taking care of you and need your sake, and we want you to be as much as we can with good quality of life. Always use both phrases, quality of life and best interest. Surgery, chemotherapy, whatever, it will not help. It's spread away and we cannot do anything for them. In order to remove or to release the obstruction in the channels, if you deliver, we can do this procedure, okay, at the same time, and finish it quickly and ask him for the concerns. Clear? Regarding the advanced directive, yes, you can tell him in the future. Yeah, it's good, but if you don't have time, you can tell him about another meeting. You can read about the procedure. If you don't have time to explain about it,
Yes.
we will be, yes, exactly.
Yeah, that
So,
is good.
yeah, we'll be sure that you are fit for this procedure and the consent form with you. Read about it. We will arrange another meeting to explain more about this the procedure complication and everything. So you make it, or you made it in one combined task, the, the, the cancer itself, the spreading, the obstruction, and the relief, how to relieve it. Okay? Other concerns in between you answer well, but you took long time. And I agree. I said before to you, don't say, do you understand me? It sounds that he doesn't understand, or he's little bit cannot understand you. Maybe he will say, do you think I'm stupid, doctor? So don't say this word or this question. Are you following me? Does that sound for you? How does that sound for you? Please, you have any concern? I appreciate, and so on. Don't say, are you for, do you understand me? Okay, I agree with this comment. I said it before, Dr. Sarah, because it's not good question. Yeah, am I clear so far? All these question, okay?
Yes, just because in this scenario, mental capacity is most important. So, and the check
Yes,
and understand is the most important. Yeah.
yes, but it's not saying, do you understand me? You can ask it, are you following me? Then if you want to check for the capacity, at the end you can say what you understand from this meeting, or what can we recap what happened between me and you, or what you collect from this meeting, but don't say, are you understanding me? The drawing also was good. I agree to draw. And at the same time, if you start to draw for the cancer, for the spreading, for the meds, for the obstruction, draw for the ERCP. The camera scan will go through your mouth to the tummy, and you use some jargon like bowel and or bowel. It's okay. I think you use the ducts. Also, Dr. Mahmoud mentioned duct. For me, I will say channels. The bile channel and the
Canal,
bile
canal. I mentioned canal, Dr.
canal.
Basil.
Okay, canal. Okay, yes, it's
Yes,
not
I
jargon.
mentioned canal.
Canal or channel is okay.
Mm.
Okay, it's good as general. You will not fail the case. Okay, because you did the two tasks, so you will not fail the case.
But
At least you have,
the time
yes,
only.
yeah, the time, but she finished, or she completed the two tasks.
Yes.
Yeah, this is the concept. But
Yeah, Dr. Mahmoud also left me more concern
yes, of
every
course. By the
time.
way, be
So
ready to
the
have a lot
scenario
of
is long,
concern.
yeah.
Yeah, be ready to have a lot of concern. But how to answer it shortly and to try to finish the task in the same time. It's
Mhm.
a game. It's a game, Dr. Sarah. You are playing a game. How
Okay.
to to finish the task, and how to address the concern during the task, and how to finish all this before the time.
Mhm.
Okay, be sure to ask about any concern at the end, as Dr. Mahmoud said. Whenever you hear 2 minutes left, do you have any concern for me? Either in the
Okay.
long or in the communication. Even you are still not finishing your task, try to ask and to get the concerns. Even you will ask it, you will answer it later on, but you have to know the concern. Why there is 4 marks for the concern?
Mhm.
Okay, just train yourself to do it whenever you hear 2 minutes left. Okay, otherwise you did good.
Yes.
And the palliative, as you did, yeah, the psychological, yes, you said the psychological. So you can say the mood doctor. He will help us to help you in your mood, because I know this is very difficult to absorb all this news, and it's very uh, distressed to hear about all the things in this session. Okay. Any question, Dr. Sarah, Dr. Mahmoud?
Thank you, Dr.
No,
Sassi.
thank you.
Thank you.
Thank you,
Oh,
Dr. Mahmoud.
Thank you, Dr. Sassi.
okay. Yes, Dr. Aisha
Okay.
also
I
add
will
the
put the
comment.
scenario
Yeah,
for
put
you.
the scenario, please. Yes. Dr. Aisha said, as I told you, better to say as we discuss. I agree, absolutely right. If you draw, will make disease discussion and procedure in the same draw. Yes, exactly, is that I said. This will shorten the time you need for both. Better to say palliative care as plan if management, not as line of treatment. Yes, definitely, right? Yeah, will you let me die? Yeah, no, we are here supporting you in your journey. You'll not be alone. Try to support him as much as you can. Why? Why I turn yellow? Yes, this is the time to explain the mechanism of hyperbilirubinemia and how to relieve the compression or the obstruction by the ERCP. So to try to use the concern as a weapon to do the task. If it is related to the task, explain the task at the same time. Okay, I need, yeah, I heard about chemotherapy. It was one of the options. However, in other condition, not yours. In the best interest of your condition, the chemotherapy will harm you and you will have only the side effect instead of the benefits.
Dr. Bassem, I'm
I
sorry, I got the scenario. I said the scenario in your in the private
No worries.
forum.
I will find it. No worry. I thought that I have infection. You answered this concern earlier. Yes, it's not an infection. It's a cancer, as you said, with golden silence and warning shots. Yes, where the scenario you said? To the WhatsApp?
Yes, Dr. Bassem.
Yes, I saw it. Okay.
Excuse me, Dr. Bassem.
Yes, sure.
Here, when we draw for to explain what happened, it's the cancer of pancreas making the compression, or the mates making the compression, or what exactly? So when we will draw for this cancer and bile duct.
Yes, I will tell you. The scenario will be detailed more than this. We always write in the scenario as a brief, but in the exam they will tell you what's the compression related to the myths or related to the cancer itself. So if they will not mention, you can say there is an obstruction with the cancer or related to the cancer. But in the exam, they will tell you there is myths to the liver, for example. Then you can say the myths or the spreading compress over the bile duct. Okay, it's not the matter. Don't worry. Either they will write for you, or you can do it as vague, not explained. So the cancer itself blocked the way of the bile duct. Even not in the liver, it can be by the cancer itself, down in the common bile duct related to the pancreas or close to the pancreas. Okay, but don't say something not written. If written, okay. If not, just make it as vague. Don't give details. Clear?
بس إضافة
Yes.
صغيرة على موضوع
Okay.
السيناريو تبع ال ERCP.
Okay, but Dr. Hind, please try to do in English
in
because we
English.
have. Yes, please.
حاضر. It's worth mentioning إنه ال ERCP إجا بأربع scenarios. Once was a diagnostic procedure in order to obtain a biopsy. فيعني دكتور باسم he's telling إنه be careful when you read the scenario. لأنه فعلا you might have been attended such a scenario where ERCP is a palliative, but in your exam the total purpose of the ERCP is different. So this scenario came as a diagnostic procedure for uncertain mass, not yet known whether it is malignant or not. So they want to go with the ERCP to take a biopsy and confirm. وإجا also it came as a ERCP therapeutic. يعني they want to relieve an obstruction and the patient will be treated for pure procedural counseling scenario. والثird variety كانت palliative ERCP as a palliative procedure just to place a stent and overcome the obstruction as a palliative procedure, as a symptomatic treatment, يعني not curative. Take care when you read your scenario. Everything will be written. Sometimes it's not written directly, diagnostic, therapeutic, but you might not face the same scenario يعني at all. but it is about ERCP. It's about pancreatic cancer, but different idea. Take care. This ERCP scenario came with a lot of versions. يعني.
Yes, always read the scenario. Thank you, Dr. Hind, for this advice. Always read the comment or the scenario carefully. It might be diagnostic, therapeutic, is it meds related or cancer related, and use it, explain it in the proper way. Don't add, don't invent, because whatever you add from your side, any word or any explanation or any details which is not written in the scenario, you will be in trouble. Okay? So the most important thing, the take-home message, read your scenario well. You can write in your paper. Yes. Yes, hello?
Excuse me, Dr. Basim.
Yes, yeah, sure.
So, Dr. Basim, what I understand now, guys, from your discussion, from your Dr. Hind comments, and from the scenario. So, when they mentioned the ERCV, like in this scenario, I don't need to go in details regarding the procedure. Is that right?
هلا شوف you are right. هلا recently when the communication scenario become 10 minutes, the whole idea of counseling about a procedure is not anymore like a fancy idea where you have to explain in detail before, during, or after. Most of the time you have to be like, mainly include the complication and the purpose of the procedure, then jump to the consent. And if there is no any more concerns, you will go back to like revise the procedure with the patient. You can go through before, with, during, or after quickly, but what you should tell in details the benefit والpurpose والcomplication of the procedure, تمام? Because those which might make the patient agree or refuse before أو during أو حتى after كmonitoring أو when we talk about monitoring with preparation, those are like routine explanation. They are not a reason for the patient to refuse or accept. But what will make the patient refuse or accept, or will open a discussion and bring up more concerns, is when you tell about the purpose of the procedure and when you tell about the complication of the procedure. So concentrate on this, and you will have, and if you are lucky, it will be a pure procedure counseling. Then give it your best. Go through the steps, be meticulous about that during, do everything, because you have a full total 10 minutes about this. But if you felt that the patient has, and you need to explain more things, like for example, uncertainty about the mass, where you need to go by the ERCP and take a biopsy. So you have to explain about the findings of an imaging and correlate this with the symptom. And there will be kind of breaking bad news and counseling about an uncertain diagnosis. So if there is multiple tasks, try to minimize the procedural steps and make them concise. If there is no pure procedural, then go in detail. But recently, I don't know why, many tutors, when they explain, they go through the old pathway, before, during, after. But from your side, as a person who is like, attending the sessions, take the full procedural explanation, use it when it is a pure procedural counseling scenario. But otherwise, if it is combined with another idea, just take the headings, the highlights, the purpose, the complication, the consent, and the concerns. Whoever discuss about a procedure, mashallah, they give you some good concerns, like sometimes the pain, sometimes like in the renal biopsy, doctor, what if I bleed? There is a possibility of double consent, renal replacement sometimes, not renal replacement, nephrectomy. So sometimes they raise good concerns in the session. So take those concerns, take the whole thing, but use it wisely in your exam. It's not necessary to go through all the steps explained by the tutors when they discuss the procedure counseling.
Yes. Okay. Thank you so much.
Yes.
You're most
Fair
welcome.
enough. Yeah.
Yeah, exactly. So either you have a procedure as single task, this is the time to explain everything before, during, and after, and the consent form. If it's combined with another task, briefly and tell him we can update you on in another meeting about the whole details of the procedure. Because never ever you can do both together in the same session and in 10 minutes. Be smart. Tell him that we will have another meeting to explain more about the procedure, the side effects, and the drawbacks and the benefits and everything. Okay. As Dr. Hena mentioned, nowadays they
Dr.
are trying
Bassem, I'm
to.
sorry.
Yeah.
I think in this scenario, the ARCP, the main task in this scenario, just
But there is cancer. He
concentrate
doesn't know
better.
about cancer. How to explain a
Yeah,
cancer. So
so that is
it's
why this scenario is long, yeah, because
no,
too
it
tough.
might be, by the way, as Dr. Hen said, sometimes they are asking the surrogate to give you consent throughout the 10 minutes. So you will not have time to talk. And might be the concern that might be raised by the surrogate will be related to the task. Doctor, how to relieve this the yellowish in the eye on the skin? You will explain the procedure by this procedure and explain the procedure. Doctor, what I have? So the cancer, is it infection? No, it's a cancer. And you explain with the cancer, for how long I can live. All this question might raised and it's related to the task. And instead of explaining more, you already address the concern and you explain the task itself. You got it?
Yeah.
So be the take-home message again, and another take-home message: be listener. Don't try to explain a lot, to draw and to explain the details more and more and more. You will find the time already wasted, and the 10 minutes are around to be finished. 2 minutes left. It's the concern, and you might be in trouble if he has a lot of concern. If you didn't give him the chance to talk, let him talk because he have a lot of concern. He has a lot of concern since the beginning. Since he start to talk, he has a concern. The good thing also, if you want to be more professional, initially while introducing yourself, at any time, at any point, if you have any concern, you can stop me. And this by this word means that you already introduced to him and you give him the idea earlier. If he want to stop you, then he can stop you. Even if you didn't cover the whole concern, at least you show the examiner that you are taking care of the concern points and that concern as a skill. Okay, it's big skill, 4 marks. Don't lose it because you are talking a lot, explaining everything. Even he's not asking about these things. Some patient does, some surrogate doesn't need to explain where the cancer to draw and so on. He want to know the idea of the management plan and the palliative, for example, and some concerns. Yes, someone wants to talk.
Well, this will be very clear in the first 1 minute when you ask
Exactly.
about the background. He will
Yeah.
immediately tell you that, doctor, I know there is a suspicious mass and I'm worried and they told me to come for a procedure. He will guide you. يعني really the first 1-2 minutes
Exactly.
it will give you a very clear يعني very clear view whether
Yes.
you have an additional task or you can only be confined to the task mentioned in the card. Because it is wrong to tell any candidate that only the task mentioned in the scenario is your only task. Sometimes they tell about the procedure, they never tell about the palliative. But if you didn't mention the word that this is a palliative procedure,
Exactly.
you will lose a big mark from your judgment, because this is not a curative, and nobody gonna tell you in your task explain that this procedure is part of a palliative care plan. So sometimes not everything is written. You have sometimes to understand or add to your task based on your discussion with the patient and based on your experience when you practice with others. You learn that sometimes the palliative care should be mentioned, but it is not in the task. وشغلة تانية, you mentioned about the advance directive and lasting power of attorney. These two topics كمان يعني they were like a big concern when it was 15 minutes. Recently when it is 10 minutes, يعني if I would have such a scenario where I'm breaking the bad news for the first time about an advanced cancer, I will think 100 times before breaking the bad news about the advanced cancer, tell that there is no curative treatment, and يعني clear, become more clear to the patient that he will not be cured, and at the same time to tell him, please write your will and assign someone. يعني it will be like you are killing your patient emotionally in one set. So I would advise you that the lasting power of attorney and advanced directive, they are under the umbrella of what called advanced care planning. Okay, and this is part of the palliative care plan, which is usually discussed gradually over the follow-up meetings. So by mentioning that there will be more steps, more discussion, and there will be like a steps called advanced care planning to help you later on to take decisions, effective decision in your management plan, and it will be discussed later without going into detail. Just by mentioning advanced care planning, the examiner will understand that you are fulfilling the elements of the palliative care, which is between two brackets, advanced directive and lasting power of attorney. Because for this patient who have a lot of concerns and he will go into a procedure, and just now he knew that he have cancer, telling him or asking him suddenly that, have you ever assigned someone? Do you have any document? We will help you to make them. يعني I think it will take by itself 2 3 minutes.
Dr. Hind, we did an idea lately, and of course, if we have time,
If we have
we will
time, I
suggest.
agree, rather than being
Yeah, but
silent.
it's not as assigned, not as something in the past, something for the future. If you are willing for anything, or you
I
are,
get you,
yeah,
and like you
yeah,
will advise him to
exactly,
make those
exactly, yes,
documents
yeah,
rather than asking him if he ever did
exactly, yes. We are doing this as a newly practice. Whenever you have such scenarios, if you have time, again, I'm repeating, if you have time, you can ask the person if you are thinking about, or are you preferring such way or any way to be managed through it in the future. Please think about it, and you can even document it. That's it.
We can help you, yes, to have the
Exactly.
documents and to have that person
Yeah.
assigned.
Yeah.
But yeah, I agree with you. As long as you have time, for sure, it is better than being
Yes.
silent in such a terminally ill person, yani, who has been assigned for palliative. But
Yeah.
otherwise, yani, we should practice the term advanced care planning, which is like part of it advanced directive, part of it LPA, and part of it the newly scenarios. I don't know if you practiced one or not. Respect form. So they are asking about as advanced care, they will tell you discuss advanced care planning. It will not only be advanced directive and LPA. You have also to discuss something called respect form.
Okay.
If you didn't discuss, we will
No,
discuss.
yeah, quickly. Yeah, we didn't discuss really. Yes.
So
Yeah.
so this is under the umbrella of advanced care planning, and it become يعني, a very important term when you bring up the palliative care.
Yeah. How to ask about it?
Respect form. Respect form, it is some form where you
Okay.
keep it in the file of the patient and you give a copy to the patient. It contains all the possible side effects. For example, such a patient with obstructive jaundice or pancreatic cancer, he might be at any time feverish, he might be at any time septic, he might be at any time dyspneic, and he might be at any time delirious. Am I right? So we will bring that respect form.
Yeah.
We'll tell the patient, in case you become delirious, do you prefer to spend the delirium period at your home or in the hospital? Wallah, doctor, since my disease, but طبعا it will not be discussed now. هداك respect scenario is totally, the patient is aware about his condition and he know that he's a terminal, and they will ask you to discuss the respect form. So you will tell him that if you get delirious, what do you prefer? Do you prefer to be at home and one nurse take care of you or one of your relative, or you prefer to be in the hospital? He will tell you, I prefer to be at home. Second question, do you prefer to receive any treatment or you prefer non-pharmacological treatment? Well, I prefer to have pharmacological treatment. So you will start to involve the patient. طبعا it's not big plans, it is like simple, and he can accept, he can refuse. And at the end, he will have a full, he and the relative who will stay with him, or the patient and the carer who will take care of him. And
Has
the
this
doctor.
appeared, Dr. Hind, newly?
Yes, it came discussed by Dr. KGI, discussed by Dr. Ahmed ID. الاثنين حكوا عنها. واجت بالبداية بيوكي من زمان تقريبا 2023، بعدين صارت تجي بالسنترز البقيان. تمام.
Okay.
Then you will have a full plan, the doctor and the carer and the patient, about what is the patient preference for every symptoms related to the terminal illness that the patient is suffering from, and what is his preference. تمام. So whenever the patient will be admitted or will someone call the hospital from home, first they will look into the respect form and they will give their orders accordingly. If the patient refuses to go to the hospital, they will not send an ambulance. If the patient refuses medication, certain medication, they will try to concentrate on the non-pharmacological treatment. If the patient is okay with some simple syringe drive or some simple IM medication or patch, they will provide it. But it will be always the least invasive form of the drug or route of administration of the drug. تمام.
Okay.
least invasive يعني we will avoid the IV. تمام. we will concentrate on the IM و sub-Q وال patches. This all will be discussed with the patient and he will agree on what you want to do, what he wants يعني. So at the time he become delirious, you cannot ask him, but you have a full plan already discussed with the patient. This is what we call respect form.
Yeah, it seemed like a detailed DNR form with a lot of
DNR is not about dyspnea and delirium. DNR
but it's options. I mean, the options
DNR
more.
عليك more, but the
Yes.
DNR you don't discuss with the patient. Do you want or you don't want? On the patient, you are discussing with him options where he can agree or he can refuse, because it's like, let's say, end of life, which you can provide or you can withdraw.
Yes.
As a doctor يعني you can provide a patch, you can withdraw, صح? and provide only, for example, morphine through syringe drive. So there are options where you can offer or you can withhold based on the patient preference. DNR is part of the respect form, but it is not necessary that every time you initiate a respect form that you discuss a DNR. It's not necessary. You might have a full respect form without deciding about the DNR status, and you might initiate both together. So they are not connected, تمام? But they are both part of the palliative care. Okay, and advanced care planning, which is an important element of the palliative care. Before, if you remember, there was a scenario where the patient has decided to be a DNR, and the LPA knows, and there is an advance directive, and by mistake the patient came to the hospital and resuscitation was done. Then they discovered that there is a DNR form.
They reactivate it again.
Yes, you are right. So such a mistake, because of such a mistake, respect form was created. That if the patient said, I'm delirious, I don't want to be admitted, he should not wake up and find himself in the hospital. Because his relative was scared and he called and the ambulance came, it will be a burden on the care, on the care facilities, and against the patient wish. فقال لك لا، نحن we set a plan,
we share with the
on
patient.
advance, discuss it with the patient. The carer is aware, the relative is aware, the patient is aware, the GP is aware, والhospital اللي هي secondary let's say tertiary center or secondary center are also aware in his file, so there will be no such a mistake that the patient will receive a treatment which he already refused. تمام. So this is the purpose of the respect. يعني والmembers who you should discuss respect with خلاص known. What is the يعني شو elements اللي you should fill in the form. النame, the condition, whether it's terminal or not, will symptoms that have been discussed, إذا في DNR ولا لا, إذا في advance directive ولا لا, وإذا في LPA. Those are what is usually listed in the respect. طبعا you can fill all the blanks بالform, you can fill, but the main issue is to fill a very clear plan for every symptom related to the terminal illness the patient is suffering from, and how you will manage in the future. وخلاص تتثبت إنه this is the management of such symptom. تمام. يعني sometimes even they ask him about the oxygen, he will tell no, don't give me oxygen, only morphine. احنا
Yes.
بنعرف المورفين بيعمل kind of relieving the pain respiratory suppression. فالاكسجين sometimes is not that يعني easy to يعني بيعمل dryness بالماوث وبالنوز وبيعمل مشاكل. ففي patients بيقول لك لا انا خليني على المورفين I don't want oxygen. simple measures والNGT مثلا انه no I don't want
Yeah, I think Dr. Ala share the form down in the chat box. It's clear about the patient
all
risk
those
form.
options.
Yeah.
all those options the patient wishes.
Even the paramedics involved. Yes. Yeah.
everyone. So
Yes.
like the patient will not receive a treatment
Yes.
which he don't want. هذا الفاينل aim يعني.
Yes, good to know. Thank you, Dr. Hind, and thank you, Dr. Ala. It's clear now by the talk and the form. Everyone can set it or he can save it, so he will know about it in details. Thank you again, Dr. Hind. We'll go to the next scenario. Dr. Mahmoud, ready?
So,
I will read the
present?
scenario
Yes.
quickly and you can start straight away. Mr. Khalid, 58 years old. Your role, you are the senior house officer at the cardiology department. Mr. Khalid, a known case of type 2 diabetes, dyslipidemia, hypertension, recently visited his family physician and with exertional dyspeptic chest pain. He was then referred to the cardiology team for further evaluation. The cardiology team labeled him as high-risk case and requested stress echo. During the test, he developed significant STT waves changes and regional and motion abnormality, indicating that he might have left main coronary artery disease. The decision was made that he should go for coronary angiography for possible LMCA stenting and if failed, coronary artery bypass grafting. Your task is to sit with Mr. Khalid, explain the diagnostic and the diagnosis, explain the need for hospital admission, the management plan, address any concern he might have. So you are talking to the patient himself. Reset the timer. You can start, Dr. Mahmoud.
Okay. Good evening. I'm Dr. Mahmoud, doctor in the heart ward today. Let me confirm you are Mr. Khalid, 58 years old.
Yes, doctor.
Okay, Mr. Khalid, we are here to discuss about your condition and also update you about the latest result, the scans. Is it okay with you?
Okay, doctor.
Okay, Mr. Khalid, before I start, can I know how much you know about your condition to be in the same page, please?
Yes, doctor. Recently, doctor, I visit the GP doctor because I have some chest pain. Yes, and he referred me here, and we did for me some tests, doctor. I think, yeah, I'm finished the test too early, so I think that I'm quite well. Am I right, doctor?
Okay, Mr. Khalid, it is good news to know about your improving. Can I know, do you have any expectation about the
No,
result?
doctor, no, just before I'm concerned regarding my heart because of the chest pain, but after I'm doing this test and I finish it too early, I think, yeah, my heart is it is well.
Okay,
Not
Mr. Khalid.
affected.
Okay, Mr. Khalid, are you aware about the type of tests and scans that you are did, or you want me to explain?
Yes, they explain for me, doctor.
Okay, are you know about heart tracing that we did? Yes.
Yes, regarding the test, yes, I'm aware.
Oh, okay, Mr. Khalid, your result has been revealed, and I have the result now. We did to you a test called stress echo, which can doing heart scanning and giving you some medication or during exercise to reveal your symptoms up and make it more clear to us. And I am sorry, the heart racing shows that you have a narrowing in one of the blood channel of your heart.
What do you mean, doctor?
Yes, as you know, the heart is an important organ of our body. The heart supply all the body with blood. In order to make the heart work in proper way, there is a blood channel which supplies the heart. is like our fist. As you know, that is my fist, and the blood channel which is in my fist, it is the blood supply of the heart. Whenever the blood supply get narrowed, the heart can't perform his function in proper way. In conclusion, Mr. Khalid, you have a narrowing in one of the blood supply of your heart. Are you following me, Mr. Khalid?
Yes, doctor.
Okay, till now, anything not clear to you?
Yes, doctor. No,
Okay.
this condition, doctor, is it serious?
Yes, Mr. Khalid, I do understand your concern. Yes, your condition is serious if not treated well. That's why the consultant assess your condition, and he is planning to admit you in the hospital now and preparing for a procedure called coronary angiography. Do you aware about this procedure?
No, doctor. Before that, doctor, may I know why this happened for me, this narrowing?
Yes, I can imagine that, Mr. Khalid. Your condition has a lot of causes, but the most main causes that you have a lot of risk factors like increased blood pressure and also increased blood sugar and also increase the fats, and also there is other causes like smoking um, and other causes. Are you following me?
Yes, doctor.
Okay, so that our plan now is to admit you in the hospital, and we will be preparing you for a procedure called coronary angio. Do you have ever heard about this procedure?
Never, doctor.
Okay, after admission to the hospital, we will do some blood tests to make sure that your bleeding profile and the bleeding tests is good to decrease the chance of bleeding through the procedure. And also we'll stop some blood thinning medication you are on and review also your medication. And then we will go to do the procedure. The procedure is doing by our heart doctor. He is expert in this procedure. We will insert a thin tube through your hand or through your groin, and this tube is called the catheter. We will insert this tube into the blood channel and going through the blood till it reaches the heart. And from the heart, we will insert it into the blood channel, and then we will inject a dye. This dye can be screened in a screen outside. We can see which blood channel is narrowing, and during this procedure, we can only doing widening of the blood channel, of this blood channel, or sometimes we insert another tube into the blood channel through the same procedure, and this small tube will be kept in your heart. Till now, any concern, Mr. Khalid?
No, doctor.
Okay. But Mr. Khalid, there is some circumstances during the procedure we will find it. After we see your blood channel in the screen and also assess whether the site of narrowing that we can't reach, sometimes we can't reach to it, and sometimes we can find another blood channel narrowing also. So this will be assessed by the heart doctor and also the heart surgery doctor. You might need another procedure called coronary angio bypass graft.
Doctor,
Coronary
you mean
artery
that you
graft.
are doing for me all of this procedure, doctor? So I think it is more difficult for me.
Yes, I can imagine how it is difficult for you, Mr. Khalid. But sometimes we must do this procedure. It will be in the best interest of your condition, and it will be more better than to not do this procedure. This procedure will, if we need this procedure, we will discuss it in another meeting. Okay. After doing this coronary angio, sometimes we might not need this procedure, but if we decide, if we see there is a lot of blood, many blood channels in your heart, or sometimes the site become more deep that we can reach it. That's why we need this procedure.
2 minutes left.
Till now, any concern, Mr. Khalid?
Okay, doctor. No.
Okay, Mr. Khalid, to be honest with you, the first procedure, which is coronary angio, has some bad effect. One of them can cause bleeding, or sometimes can introduce some bugs. That's why we will keep in the hospital. We will follow you. We will monitor you. If you have any bad effect, we will monitor you. If you accept, you have to sign the consent for the procedure, in which all information written. You have to read it clearly, and if you have any doubt, you can withdraw anytime. Mr. Khalid, do you have any concern?
No, doctor.
Okay, can I ask you, do you smoke?
Yes.
I advise you strongly, Mr. Khalid, to stop smoking, because it put a risk in your condition. Do you drink alcohol?
No, doctor.
Okay, what do you do for a living?
Yes, doctor, I'm taxi driver.
Okay, Mr. Khalid, you have to hold the driving. I will give you a letter. You can facilitate to take sick leave, and also I can involve social worker. He can solve any problem if you have. Okay, Mr. Khalid, you have to stop driving, as I told you. Okay, any concern, Mr. Khalid, now?
I think for stopping the driving, doctor, is difficult for me, because this is my only job, and from where I get the money.
Yes, I can imagine that, Mr. Khalid. It is difficult for you, but I'm sorry, you are talking now about your health. So we are talking about losing your job versus losing your health. So you have to think about that. And for that, I can involve a social worker and also occupational health department. I think they have many options for you, and they can solve your problem. Is it okay with you?
Okay. Okay, doctor.
Thank you, Mr. Khalid.
Okay, thank you.
Okay, time is up. 1 minute added for the driving issue. But let's start the comment now. Dr. Sarah.
Yes, Dr. Mahmoud, he did well. Yeah, just if you are drawing for the conditions and the procedure, it will be fine. And also regarding the complications of the left coronary disease itself and the heart problem, like this life-threatening conditions, and it may, just to highlight the complications, okay?
Yes, doctor.
Regarding the cause, yes, just the surrogate, he didn't mention regarding he has diabetes and dyslipidemia and other, I think, hypertension also. Yes, we need to mention it from the start. Regarding the cause of these conditions, it might be clot or it might be atheroma, but you can explain regarding sometimes clot or sometimes fat building with time and causing for you this narrowing or occlusion, okay? So when this happens, the blood flow, it will be cut to supply the muscles of the heart. That's why you feel this pain and and other complications. Okay, so apart from that, yeah, you did well.
And the CABG, Dr. Sarah? CABG. Explain the CABG, or
regarding the coronary artery bypass graft, yes, just it mentioned in the scenario, if the stent it fail, so the another options it will be CABG. So sometimes we can take some blood channels either from the upper side or from the chest to replace this defect or damage blood channels in your heart and to bypass this. Okay.
Okay.
Yeah.
Okay.
A simple like that. Yeah.
And the driving,
So
Dr. Salim?
regarding the chronic
Yes,
driving
go
test
on.
should be stopped in this situation, and will be discussed later when he can resume his driving, because now his condition not yet treated.
And when he said that there is the only income for me, what will you do for me?
Yes, you can offer the social worker, okay? Because
Okay.
he's a private taxi driver, not related to any job.
Any company.
Yeah, any company, I mean.
Thank you, Dr. Salim.
Thank you, Dr. Mahmoud.
Okay. Thank you, Dr. Sarah, for this today. Well done, Dr. Mahmoud. As
Thank
usual,
you, Dr. Basim.
I will just add in the introduction, she told you something very important and you didn't address it. She told you, doctor, I finished the test
Yes, I
early.
forget it also, yeah.
Yeah, that's
Okay,
why I'm
yeah,
writing
continue.
in the chat box.
Yes.
Yeah, so she's expecting that he's fine, or he's expecting that he's fine. So you have to address this concern, Dr. Mahmoud, right?
Yes, Dr.
I'm
Basim.
sorry to tell you
I
that,
told,
yeah.
but I
Just to
told
correct
her
our the
it is
surrogate
good news.
information. Yeah.
Yeah, he
Yes.
misunderstood the test that he finished early, so he's fine. Heart is
Yeah.
good. No, the issue here, the test is aborted because he's not tolerating, and he has the coronary artery
Develop
disease.
ST, yeah. No.
Exactly. So you can say instead, the news is not as you expected, or it's not good as we hope. It's like denying what he's expecting, right? You have to do it in this way. No, it's not as you hope, or it's not as you understand. It's wrong
Yeah.
understand by you, and
So
correct
I'm
it.
sorry. Yes, I'm sorry
Yeah,
for that.
yeah, because
It's
he's
not like
giving you the
that.
expectation.
Yes.
She was volunteering to say to you the expectation. You didn't ask about the expectation, and he's expecting something good, which is the opposite. No, it's not good as we hope, or as you hope, or as all of us hope. No, there is something called coronary artery disease, and go ahead with the explanation as you did exactly. The procedure you explain well, the preparation, the during and before and after, and at the same time you address the issue of CABG. It might be done in case of failure to reach or to approach or to access the blood channel, which is also away from our stent or our procedure. And it will be arranged in another day as another surgery, and it will be with big cut in your chest. It's a major surgery, right? It's not something to be skipped. It's a major surgery. So you can tell him in another meeting, we can provide you more details about the other meeting. The driving issue, it's 1 month, as you know. So you can tell him, you have to stop it until we'll be sure that you are okay. Yeah, doctor, this is my only job. I depend on my job. We need your safety, and we need we are caring about you, and don't worry about the income. We can help you regarding this by referring to you to any department he needs. Okay.
Okay, Dr.
Yeah,
Basim.
this is in summary, but in general, you did well. Apart from the introduction, you have to tell him that the news is not as he expects. He repeated to you twice that I'm
Yes.
good, doctor.
And I suppose it is improved. And the symptoms improved.
No. He
That's
told you
why I
that.
told her it is good news that
Yeah,
I listen.
Thank you for the test. Yeah.
you prove to him that he is. You are also
بتضيع غلطة زي دي.
in the wrong track with him.
Yes,
Yes, it's good news.
but my mind, Dr. Basim, that is in the rest, يعني sit.
No,
So
no.
that's why she is improved. So
No, she the opposite. He's saying that I'm fine and the heart is good, and you have to address it immediately. No, it's not as you hope or as you expect.
Yes.
It's something different totally. So then explain the other, okay?
Okay, Dr. Bassam.
Yes, I wrote the concern down in the chat box. I think yes, is it serious? Yes, serious. If not treated well, it might even threat your life. You might have heart attack if you don't go through this procedure. And as you know, the heart attacks, very serious issue. It might threat your life. I think, yeah, my heart, I already answered. Why it happened to me? Because the comorbidity, not to say comorbidity, because you have multi-condition like diabetes, dyslipidemia. Smoker, you can address it early and at the same time give him advice.
Yes.
Sometimes in smokers, it happens. And he will tell you, yes, doctor, I am smoking a lot or I'm whatever the amount, so you can address it immediately. Okay, and at the same time, you give him one of the risk factors. It's not only the diabetes or dyslipidemia, even the smoking as a risk habit, he's doing one of the risk factors. Why you explain this procedure for me? Because it's very important in the best interest of your condition. We have to do this procedure and you go through this process. Why? In order to have good quality of life, you have no chest pain, no short of breath. Since you are doing this, all these things and symptoms will be managed. Otherwise, every now and then, with every simple exercise or any effort, you might have these symptoms again and again. So you have to be treated with this procedure in the best interest again. So quality of life, best interest. This is always as a weapon, use it. This is my my only income, we mention it. But for your safety, for others, you have to take rest. Don't do it as a force. No, don't drive. No, you have to take rest. We are taking care of you for your safety, for others. Okay. Don't use it as by force. You have to stop driving now. It's dangerous for you. Do it in another good way, with calm, convincing way. Okay.
Yeah, doctor.
Okay. Otherwise, you did great. Let's me read the last. Yeah, Dr. Gabriel. Rather than involving occupational health, I thought that the citizen advice bureau unit should be the department to involve. Exactly, we mentioned that it's not occupational because it's his own job. So you can say, and the social or the support we provide you the support that you might need in the future. Whatever, either social or occupational, but don't mention the occupational because it's not related to a company. I believe you can say any kind of support you need, we will help you through it. That's it. Make it as a vague one. Don't mention or specify the service because they will write for you. You are utilizing our services for unnecessary things. Clear?
Clear, Dr. Bassam.
Okay. Anyone want to comment? It's open.
بس الريسك فاكتورز
Okay.
يفضل انه كمان ما ننسى الايج being a male.
Okay.
تمام لانه
Yeah.
he might surprise you that his comorbidities are controlled. He
Yes.
might not be a smoker. From the start put the male and the age also as a part of the risk factor, which يعني by itself are enough to cause any heart problem.
Yes. Clear. Yes. Right.
Sorry, doctor. Age and what?
Age and the male gender.
Being
Gender.
a male gender.
Yeah, gender. Plus the other risk factor, you
yeah.
might have another
Family
explore.
history. And sometimes even you find this as a concern that doctor, one of my family member had the same, and he went through the procedure and for example, he lost his life or he had to repeat. Yani family history, sometimes it is a risk factor, but at the same time, it's a hidden bad experience, which is the reason behind the refusal of the patient. So it will be, and it will help you by two means. A family history will be an added risk factor, and you will open up the way in front of a good concern, تمام, which might not be asked if you didn't mention the family history.
Yes.
Yes.
We try always to enumerate يعني تمام إنه there are multiple risk,
Yes.
including he will volunteer if he had any of those, but don't ask as a history taking any. Be
Yes.
careful.
Yes.
I have one comment, Dr. Bassem.
Yes, Dr. Ala.
Yeah, I told Dr. Mahmoud before, please read the scenario carefully. Okay.
I read it, Ale. What I do now?
Okay.
This scenario
yes.
written in the scenario, they are suspecting left main coronary
Yeah.
obstruction.
More details.
That's why there is the issue of CABG, of coronary of bypass. Okay.
Yeah.
So this should be mentioned. This should be explained to the patient that we are suspecting blockage of one of the main blood channels to your heart. Yeah, that's why we have multiple options. That's why we are discussing with you two different procedures. If they are not suspecting main channel occlusion, they will not offer from the start CABG.
Exactly, yes. So it's a matter of, again, reading carefully and focusing, concentrating. I agree with you, Dr. Ala, yes.
Just I add the short comment for the explaining the procedure itself. Just make it more in shorten time of explaining the exact procedure, because you have causes that you will do the procedure and the complication and the patient concerns and the risk factor that you will mention also. So I think we take long time explaining the exact procedure and in many details. You can train like saying about all the procedure in 3 minutes, and you can remove the words that's not very necessary or the patient will not benefit from it. Like we will see on the screen, and start with this procedure can be as a cure or can be only to scan and to know more about your blood conduit or blood channels. Yes.
Yeah, so you want to shorten the explanation of the procedure?
Yes, because he have no time. He takes
and he has another
time
procedure
with complication and explaining the cause of this procedure and also the risk factor. He has no time for social and driving and other risk factors he may found in this case.
Yes, exactly. Plus the CABG itself, he didn't have the time to
and he
talk
didn't
about
have time for CABG. But as he said, we may need the CABG. He can just mention that because he should be honest that the procedure can be failed or we can't cure you after this procedure and we will need surgery again.
Yes, exactly. Okay, thank you, Dr. Aisha. Thank you so much. Dr. Ala, you want to comment?
No, thank you, Dr. Bassem.
Just simple thing إنه الكونسنت هون بهذا السيناريو, in this scenario we call it double consent. لأن in one paper he is signing about PCI, and if PCI failed about CAG.
Exactly.
And this will not be discussed in the middle, and he will be shifted from the PCI theater to the OR theater at in a second, so there will be no papers, no signing. So he has to understand that in the consent that you will sign, both procedures with their benefits and risk are mentioned, and by signing the consent you accepted that in case the first procedure failed, we have to take an urgent and immediate action and shifting you to the OR and start the surgery. I think also it should be very clear in the PCI, the patient usually is conscious. It's a procedure under conscious sedation. While the CABG is a major advanced surgery where we'll open the heart. So I think these things, it matter more than the steps of the procedure. That he should understand in the PCI you are awake, simple procedure. We will be able even to take your opinion during, do you feel symptoms? Do you feel pain? You will be interactive. While the CABG is a major surgery where there will be general anesthesia. At least he will understand from where he will be shifted from a PCI where he's awake to a CABG where he will be totally, a major surgery. So, and the double consent. So this will be, I think it make a difference for the patient. Because sometimes they think, if I may need the CABG, معناتها in case the PCI failed, you will come again and discuss with me that, oh my God, we failed, we need to go to the CABG now. So you have to be very clear that there will be no more discussion. It will be one step. No PCI failed, immediately shift you to the CABG.
Yes. Yeah, okay. Thank you, Dr. Hind. Thank you, Dr. Ala, Dr. Aisha. Bas, anyone want to comment? Sorry?
Is it wise to mention social welfare in such a scenario? Yes, it is clear social life of the patient not affected. Financially,
Is it your voice? Sorry, Dr. Khalid, your voice little bit muffled. If you can be clear.
My comment, is it wise to mention social welfare here in such a scenario?
Yes, because he's dependent on his own job, so we can refer just because he insisted about it. Doctor, it's my only income. So how you can solve it? Okay, but if you already address it, you cannot drive now, and please, for your safety, and he stopped and he didn't ask again, it's enough. We will support you till you can resume driving back. But if not, and he's insisting, no, doctor, I need this money, so we have to address it by referring to the service that he might be need. Okay, you got it, Dr. Khalid.
Yes, thank you.
Yeah. So it's about the dependence on the own job, and he's insisting why and how I can depend and how can I do the life things, how can I help my family. In this way only you can refer. Otherwise, you will address him that please stop driving for your safety until you will be recovered, and we'll reassess you back whenever you are okay to drive back. You can do it. Almost it will be for 1 month. It will not be longer unless you are having some complication and so on. But it will not take all these details. The most important thing to address the driving and to ask about it, and that's it. Okay? Raise the issue of driving. That's it. But they will not ask more details. No, doctor, we are sometimes exaggerating the issues. No, doctor, I depend on this. I need it for money. But I think if you reach to this point in the exam, that's enough that you raise it. Otherwise, go ahead with the alcohol, smoking, and the dependence with him, who's dependent on him, and so on. The other social issues. Okay? Anyone? Yes.
بس
Yes.
addition بسيطة إنه usually the details of the DVLA regulations can come as a separate scenario, especially in the MI, in the stroke, in epilepsy, in vasovagal. So be careful hypoglycemia, whether due to insulin or not. be careful إنه you are aware of the regulation, you are aware of such a discussion, you can go through it in detail in case it came as a separate scenario. But when it is part of screening for social or part of discussion, then you can handle it quickly and brief.
Yes, exactly.
And even tell the patient that since this is an issue, we can discuss it in further detail and find a solution. And you can skip it as simple as that. And okay, there will be another meeting. There will be a specialized person who is concerned on solving these issues with us next meeting. That's it, yani, to find a way to help you with your daily chores or with your finances. But there are DVLA scenarios, so be careful. No, regulation should be very clear about the common scenarios. Yeah, driving is important.
Okay. Thank you, Dr. Hind. Thank you again, thank you, Dr. Khalid. Thank you, Dr. Aisha and Dr. Mahmoud and Dr. Sarah.
And thank you, Dr. Basim, really. Thank you.
Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh. Yes?
Please have question or comment. As
Yeah,
Dr.
sure.
Head said, the patient, if the CAG is filled directly, he will shift it to CABG. Actually, it's not necessary, as the CAG here is not a primary. It's secondary and need prepare before, and also the CABG is very huge surgery and need very operative preparation. So, as it's not primary CAG, it's not necessary to shift directly to CABG.
Yes.
I'm not agree with Dr. Hind about this.
Okay, let's talk honestly. It's not the matter of is it important or necessary or not. You might have no time to do this step. So you will explain the CAG, coronary angiography, and there is possibility to be a CABG, and that's it. You might not have the time to go through. We might shift you. Yeah, so it depends on the
I agree
scenario.
with you about this, because if
So,
I,
but
if I
Dr.
said
Hind,
we will shift
sometimes
you
giving
directly from CAG to CABG, that means
no,
I have to explain CABG in very detailed
yes, okay,
operation, because it's very, very major operation. I need to be aware about all the details about it. So it's
You shouldn't explain. In this scenario, you are giving him the management plan as a doctor. You are not signing him on any consent.
yeah,
You
but
know?
at the end of scenario, I should sign him, or at least
No,
to
no,
say,
no.
are you agree about CAG, about this plan of management or no? At least.
yes. So that's as idea. If you want to do it, if you have time to, it's not necessary to do it. Okay, we agree about that. But if you have the time, you can offer it. So you might have shifted from here to there, but it's not necessary to say that.
Oh, okay.
So sometimes we are giving the ideas how to
Just
solve.
idea.
Yes, but I think it's not that much necessary. If you will not do, they will harm and they will minus you. No.
Yes, especially it is not written, Dr. Bassem, in the scenario.
Yeah. So it's just ideas we are discussing as possibility to talk.
في معنا حدا cardiologist لأني أنا متأكدة
Yes, doctor. I
usually
work.
when PCI
Dr. Mahmoud
fails,
It
we
is
go
never.
for a CABG immediately.
Dr. Hind, we are not saying you are wrong. We are talking
Yes,
about
doctor.
إنه
cases. We are
الدبل
talking
idea
about
of the double consent
yes,
مع ال PCI when it
Doctor.
fail,
But I think
patient he
Dr.
will
Hind.
be in a critical situation يعني.
We are
I
talking
think
about cases, Dr. Hind.
yes.
We don't have the time to.
The idea of double consent even is in the PACEs. For example, for the renal biopsy, you would double consent the patient if the renal biopsy will be shifted to nephrectomy. Will idea the same go on for the PCI and CABG? And whenever a procedure fail, we have the second thing, يعني the second step is ready and we have to go for it. I agree with the idea is الCABG is ما في قبله PCI. مثلا
Okay.
I have an angina والانتي انجينال didn't work وعملت بريدجينج بالميديكال تريتمنت وام preparing the patient for CABG. okay, هون الCABG is a routine. But in this scenario it is written if the PCI fail, patient should be shifted to CABG.
Yeah. We are not talking about the
patient
consent.
to the ward بعد ال PCI.
No. We are not talking about the consent. She is talking about the details of being anesthesia or other.
لا no details as long as إنه he should understand the nature of each procedure.
So briefly, not
yes,
everything.
briefly حتى I will not tell her that we will take a vein, what we will do, just it's an open advanced surgery and يعني you have
it needs another meeting to be explained
and
more
there will
about
be
it.
عليك نور. بس the idea of the double consent, I know that it's a practical thing and at the same time it's a common in PACEs. You are signing in, when you sign the consent you agree for both.
Yeah, at least we will not forget the consent after all this details.
يعني بس
some
إنه
doctors
double consent
yes
biopsy and still I remember
I agree,
renal biopsy when this scenario we used to call it a double consent because it contained two procedures يعني. If one failed we go to the another.
Okay, Dr. Mahmoud, you want to say your opinion as a cardiologist quickly?
Yes, Dr. Hind. We never. I work here in Saudi Arabia for 7 years. We never do double consent. We do consent for PCI and consent for CABG. And we never يعني patient from PCI to CABG never do it in our center.
يعني قصدك إنه usually the patient will come out to stabilize and then you take him to the CABG.
Yes, and
very huge procedure operation.
Yes, doctor.
So
we take
prepare.
Yes,
I don't know.
and we prepare and see the CD of the patient and make combined meeting.
Everything.
Yes.
And the CABG will be done by the cardiothoracic surgeon.
Yes, it will be combined meeting between cardiology and cardiac surgery.
بس يعني هون since they are dealing with a high risk patient فواضح إنه they are preparing themselves إنه it will fail. مرة وقت I did it with people I understand إنه البروتوكول usually إنه from PCI to CABG لأنه they know that they are dealing with a high risk patient.
Never happened in our center, Dr. Hind. Never happened.
خلاص
I think it needs another.
What mean when Dr. Bassem said practical is different.
Yeah.
يعني the idea of the double consent it used.
Yes, it's okay to mention even the mortality.
Yes,
in the
we-
consent.
yes,
Sometimes
we-
cardiac arrest, we are taking
and
consent for it.
yes, and we see 3 vessels disease in the BCI, and when with meeting with cardiac surgery, it refused. It refused to do CABG. Yes,
Yeah.
it refused.
It's not, yes, it's not a cardiologic decision. It's need
Yes.
also the cardiothoracic decision
surgeon
because
will
he's
do
the
the
one. Yeah,
CABG.
exactly. Yes. So it's complicated more than we are suspecting, but it's okay to raise this issue and to understand the things. We are learning from each other's and the
وأعتقد
specialty.
السيناريو yes يعني whatever is written in the card whatever the patient consent will guide but it's an idea يعني use it
Exactly.
in no sense in practice sometimes we have a chance or they might discuss it again but it came to my mind لأنه in these two things I always remember إنه يعني there are two procedures that the whole team is ready that if one failed the next will be carried out immediately.
No, it's not one team, as you said. It's a double team. So even the nurse will be different. This is another surgeon, and this is a non-invasive interventional radiologist or whatever the nurses. So it's not even the same team. We have to prepare for another major surgery. Even the machine should be connected. It's open heart, right? The anesthesia, the heart machine, the ECMO, everything will be prepared before saying or doing such procedure. I mean the CAG. Even maybe in another building, some department will be in another building, so you cannot shift the patient.
According to what you mentioned, it might need a whole preparation steps.
Yes, this is what I think Dr. Mahmoud also can confirm. It's another major surgery. Even the preparation itself, maybe
Yes,
the blood,
even
the
Dr.
blood, the
Bassem,
hemoglobin.
it is also another ICU. يعني there is another CCU for
Cardiac surgery,
CABG. Cardiac surgery
exactly.
CCU. It is another CCU, other than the CCU.
Okay, so we learned another point today. But the take-home message: if there is possibility to have two surgery or two procedure, you can do one consent or double consent. You can offer it, or even you can add it as the possible advance advance or another surgery or another procedure might be done if not successfully done at the first one. Okay, you can raise it in another point. So we have the consent form about both procedure. Please read about them carefully and so on. Is it clear now for all? Always the discussion clarify the fix. So it's okay to raise it and to understand more. Everyone will benefit from it. Anyone want to add any comment to suggest? Any question before ending the session? Now quiet, all of us.
الله يعطيكم العافية.
Yeah, so if quiet means all satisfied.
ما نحن ما تركنا شيء ما ناقشناه خلاص.
No, it's a good session, really.
كل
It's good session, really. It's good session as usual. We are learning and we are helping. We want all of you to be gaining a lot of information freely as our purpose. Freely study, freely practice. Thank you, Dr. Hind. Thank you, Dr. Mahmoud, Dr. Sarah. Everyone shared and interact today. See you tomorrow, inshallah, with a short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Dr. Bhatt.
Thank you.